All right, so as of noon today, from noon on Wednesday, there were 33,635 new positives across the state. There were 288 deaths. Cameron County went up 3, Centre County went up 419, Clearfield County went up 325, Clinton County went up 165, Elk went up 64, Lycoming 360, Northumberland 301, Potter 42, Tioga 165, Union 223. North Bend now has 6 confirmed positives and 1 to 4 presumed positives. So that means that there's somewhere between 7 and 10 positives in North Bend. Renovo went up 1 to 27. We are aware of at least 10 additional positives in 17764 that have not yet been reported. So there are at least, by our count, 37 positives in 17764. Carthus went up 36. Oh, that's most of Carthus, isn't it?
It is, yeah.
Snowshoe went up 8. Mill Hall went up 17. Beach Creek 5. Lock Haven 95. Jersey Shore 45. Bellefonte 177. State College 89. Loganton 4. Williamsport 149. Lock Haven University is now reporting 1 active positive for a 0.04% infection rate, but their overall infection rate is still 4.8%. University Park has not updated their numbers from last week on the 23rd, but they are showing 4,846 accumulated positives. 354 are currently infected, with 8 quarantined and 31 in isolation. They're waiting for results on 182 tests. Positivity rate remains the same. It did not change today from last week, so Clinton County's at 10, Center is at 6.7. So it's very clear that we're still in a very hot zone in north central Pennsylvania. The numbers here and around us just continue to escalate. We're seeing numbers much higher than we've seen before. For the month of November, the positives on the month of November equal more than the positives for the last 7 months combined in Clinton County. We're going to continue doing our weekly testing of staff and residents here. So it's Monday, we're starting another cycle. We start with the direct care staff, we'll do the residents, and we'll work our way back through the offices. I think Beth's been able to order some more kits, so we will keep ordering those. I know that we did at least 20 outpatients today out in the parking lot.
Negative so far.
Everything negative so far.
Yeah.
So if we're keeping count, since April, we've had 3 positive staff. One of those was quite a while ago. That person has fully recovered. We've got 2 staff currently positive and isolating at home. We've had 0 resident infections so far, which is good. I think the plan with the masks and being able to sanitize those on a daily basis and getting clean masks back to everybody is going to help. I told the group this morning, my sister is a physician at Temple. They're issued an N95 mask for 5 days. They keep it with them for 5 days. So it doesn't get sanitized or cleaned in between, they just keep it for 5 days. I'm much more comfortable that we sanitize after every day's use, so that when you come in every morning you have a clean mask. The sanitizing process seems to be working pretty well. according to the manufacturer, based on the exposure that we're giving, we're using the UV light, and based on that exposure, we should attain 99.9% sanitation. We did have another potential exposure over the weekend. We were able to keep that situation under control, and I don't believe that it posed any significant threat to anybody in the building. As far as vaccine, they're supposed to be starting to ship this week. I don't know where we are specifically on the list, but what I can tell you is that our arrangement for storage is with Omnicare in Williamsport, which is part of CVS. They have the equipment to maintain that vaccine at 70 degrees below zero or colder. So any vaccine that we get goes directly to CVS in Williamsport. Then they also have the ability to bring that here to us as we need it. And what that looks like right now is with dry ice. So with enough dry ice, we can keep that vaccine cold enough for up to 10 days. So we can bring it here, use it, and know that it's safe for at least that period of time. If we need to keep it here longer than that, we need to put it from that original dry ice container into a new dry ice container for another 10 days. But we do have that in place so that when it is available for us or for the community here, we can get it. With the positivity rates over 5%, we will continue to test 100% of our staff and residents for at least the next 14 days. So everybody's got at least 2 more tests coming. My guess is that's going to continue to escalate. And we're going to be doing weekly testing probably for, I would say, the next 2 months. But we'll have to see how things go. Questions?
Bucktail Medical Center is going from here for call.
All right, that's all I have. Thank you.